Yes, welcome all the doctors today. Thank you so much for joining this lovely Sunday afternoon. It's raining heavily here.
Yes, welcome all the doctors today.
Just give me a second. Yes, so it's raining heavily here, and we are thankful to all of you for joining us on this lovely Sunday afternoon. We have Mr. Anuj Kumar from Maharishi Ayurveda with us today. Thank you, Anuj, for joining on a Sunday. We know that professionals like you don't like to work on Sundays, but still you manage some time and here with us. And I thank all the doctors and all the participants, students, and other people who are right now with us. Uh, it's an very it will be a very exciting session today because something different we try to offer you. We are talking about Ayurveda technicalities, modalities, but there are certain other challenges, certain other opportunities, and especially the professionals like Anuj. We need to take some insights, take some inputs, and maybe we want to listen about his experience because Ayurveda now, as it's growing globally, we need more and more professionals like Mr. Anuj Kumar with his background and his experience. I think Maharishi Ayurveda, the entire Ayurveda community, and we all are very much fortunate to have him in the domain of Ayurveda because there are very less people right now, as I see. Because personally, I have also worked across several pharmaceutical organizations like GlaxoSmithKline, Max, and all. And right now, also, we are dealing with so many companies. So, learned and experienced professionals like him are very less as far as Ayurveda is concerned. And we need to grow now. The whole world is looking forward. This is a new year, 2021. So, we just thought to have him today and let's understand from him how he sees the entire Ayurveda domain in terms of the company aspect, in terms of the practitioners, how the patients will be getting benefited as maximum as possible. So, as far as Anuj is concerned, Mr. Anuj is concerned, he holds a bachelor degree in pharmacy and an MBA from IIFT Delhi, a very prestigious institute, by the way. He has worked with Fortune 500 companies like GSK, Lundbeck, and also have stint in healthcare consulting. He has also authored a white paper on market access published in an international journal. He is right now pursuing PhD, and you need to listen his topic from again Indian Institute of Foreign Trade, and his topic is sensory branding in Ayurveda. I think Anuj, we all need to learn more about this as well from you today. And currently is working with one of the largest, I will say, global Ayurveda company, that is Maharishi Ayurveda, as a senior brand manager, and he handles the ethical marketing channel. So thank you so much again, Anuj, for joining us today. In fact, we will have your presentation also. However, first, we want to understand that from Fortune 500 companies and now you are in Ayurveda, how and what clicked in your mind, and what exactly, in fact, there is a reverse pathway we have seen. People started their career from Ayurveda and then going to the pharma companies and bigger MNCs and all. But I think you are on the reverse track. So, is there any reason for that, or like you have some kind of a passion, or what? Like, we need to understand this, right?
So, first and foremost, very happy New Year to all the doctors. Wishing from the entire family of Maharshi Ayurveda a very, very happy and prosperous New Year. To all the doctors that are seeing this and who have been instrumental in propagating the value of Ayurveda. Dr. Piyush, you rightly mentioned that Ayurveda today is, on the cusp of becoming one of the pivotal forces in terms of managing such serious challenging healthcare conditions even like covid, right? And we will see in the time to come as to how this entire thing pans out. But answering your question as to why I came into Ayurveda, so I always believe in a saying that man proposes and God disposes, right? So I have worked in Fortune 500 companies, GSK, Lundbeck, consulting background, author a white paper, hardcore pharmaceutical guy. But then one fine day, I got an opportunity to work with Maharshi Ayurveda, and I must say that was a very conscious call in terms of my horizon for the career, and I knew at that point of time that Ayurveda is certainly poised for bigger things. And I must say that I have not been shy from saying that I chose to make a career in Ayurveda. And I must admit that Mahasi Ayurveda as a company, they have provided me all the avenues to kind of broaden myself, my skill set, my knowledge in the Ayurveda and the various other facets. And it has been a fascinating journey of 3.5 years that I have been with the company. Have learned so many new things, how Ayurveda is different from that of allopathy field. But I see there's a lot of similarities, a lot of parallels, and certainly there's a lot of learning that I can pollinate from the field of pharmaceuticals to the Ayurveda field. So, Dr. Piyush, it's been an interesting journey, and I certainly see a very, very bright future for everybody who's joining Ayurveda, and this is the right time to be in Ayurveda.
Right, great. And as far as when you shifted from pharma to Ayurveda, so were there any apprehensions? And we know Maharishi Ayurveda, we all know Maharishi Ayurveda as a company, but very few maybe as a doctors we are not aware. So how your journey so far? I think you are there from last, if I'm not wrong, around 3.5 years, maybe, because from last 2.5 years I am also in connection with you. So, how is your journey in Maharshi Ayurveda, and what do you feel right now? What do you think? You made a right decision, or what? Like, although
Obviously,
officially, definitely, you will not reveal, but maybe in general, you can let us know that how it is going on. And after that, maybe what we request is you can start directly with your presentation. I know we have a presentation today. I request all the doctors, all the people who are watching us live right now on Facebook, YouTube, Periscope, and a very significant number. I've just checked are watching us live on our website, that is indianvadyas.com/webinar. So I request all of you that you can feel free to post your queries, your questions during the presentation as Mr. Anuj will deliver the talk. And when he will complete his session, we will start taking your queries. We will start taking your questions. We got a couple of questions. We have floated this event day before yesterday. So there are few doctors who have requested, they have some queries specifically regarding Maharishi Ayurveda. We had a technical team till now, the doctors and the research people, but we were not having any person from marketing. So now you are the first person, and we what we will do is we will have some issues, and I will say some queries from some doctors. So we will take that after your presentation. So let us know about your experience, and maybe then you can start with your presentation.
sure. So, Dr. Piyush, answering your first question, how has been my journey in Maharshi Ayurveda, and whether do I regret, whether I'm happy? So, on record, I can say that the journey has been very, very fulfilling. And in terms, not only in terms of learning, but in terms of spreading my wings, accumulating newer skill sets, and understanding the finer nuances, the insights, and all on which I can build my marketing strategy and the understanding of the Ayurveda domain. And one of the apprehensions that Dr. Piyush, typically any professional will have joining a promoter-driven company is, about the culture, right? About how the promoters behave, because we all know that, certain promoter-driven companies, people don't find the culture palatable to their working style and all, because if you work in professional driven companies, it's a very different kind of atmosphere there. But I've been very lucky, and the entire marketing team and everybody who has joined us, in terms of the contribution from the promoters, be it the chairman, be it the all the family members of the Maharishi Ayurveda. There have been a very, very dynamic shift that I see, both in terms of the cultural shift, and both in terms of giving you the avenues to kind of learn and kind of spread your wings, because there's no constant scrutiny as to how things are shaping up, what is happening, what is not happening, right? So in that sense, I must say that, as a company, Maharishi Ayurveda has given me a lot of avenues, be it in terms of the learning the markets in the European markets, be it in the domestic markets, also understanding the clinical aspect. So I'm involved with the clinical team of Maharishi Ayurveda as to how do we conduct a clinical trial, what are the other areas in which we can look at to conduct kind of clinical trial. The other benefit which I have immensely been benefited is practicing transcendental meditation, because at the end of the day, you need a peaceful mind and a thoughtful mind to be very creative and to understand the entire entire landscape. So in that sense, till now I've been very happy, and I must admit that it's been a fulfilling journey, and I hope to contribute to not only to Mahasi Ayurveda but Ayurveda category and Ayurveda fraternity in general. And many of the doctors would have been seen that over the last 3.5 years, we have been very active on the doctors front. We have conducted many CMEs in different parts of the country, interacted with many of the doctors, have done a lot of healthcare camps, diabetes camps. Yeah, in the lockdown, we did a lot of webinars to reach out to the doctors, and it's been a very enriching experience learning from various doctors in the Ayurveda fraternity, some big names, and they have certainly helped me to grow as a person and understand the dynamics of the Ayurveda landscape. So my thanks to all the Ayurveda doctors from the entire family of Mahasi Ayurveda, and I like to go to my small presentation that I will like to share with all the doctors. And I hope, Dr. Piyush, my screen is visible. I hope, Dr. Piyush, my screen is visible. Hello. 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 Hi, Dr. Piyush. Okay, so I think this the screen is visible, and I would like to welcome all the doctors with again the with the blessing of Mahasi Maheshwagiji, who has been our guiding light and who has been the pioneer in the field of Ayurveda, propagating the holistic benefits of Ayurveda at a world stage. And his contribution, nonetheless, is one of the finest in the field of Ayurveda and in the field of transcendental meditation. Mahasi Ayurveda, over the years, if you look at three decades plus journey that we have had, incepted in the year 1986, and through this journey, we have had certain very prestigious certifications to our credit. Mahasi ji always believed that Ayurveda has the potential to go at a global scale, but he always stressed upon the point that without the credibility, Ayurveda will not be able to go on a global scale. And that's why he was instrumental in kind of setting all the standards and the benchmarks, saying that we need to function like a professional healthcare company and a professional company in which everything is standardized and which has all the systems and processes and checks in place. So over the 3.5 decades that we had, certifications like the prestigious ISO certifications, WHO GMP compliance certification, and the prestigious Ayush Premium Mark in the year 2010, and various other certifications, the NABL, the EU for the EU markets, vegan certifications. And in the year 2018, we changed our brand identity to keep sync with the changing times. So over the 3.5 decades, we have also conducted some of the clinical trials in very very prestigious institutions, be it in the US, the Canada, Netherlands, India, and Japan. US prestigious places, colleges like the Canas Medical Center, Ohio State University, Canada University of Toronto, Netherlands, India, the Holy Grail of medicine, All India Institute of Medical Sciences, SMS Jaipur, King George Medical College, and in Japan, which is a very, very highly regulated market. There also we have done a clinical trial at the Gifu University in Japan. So I mean, Mahasi Ayurveda has conducted trials in very, very prestigious research institutes, and these researchers, they have come in some of the very serious disease indications. If you look at oncology, so I worked in oncology segment also, and this is a very, very serious, kind of disease to which also modern medicine is not able to find answers. There also we have done a clinical trial. Anti-aging, neurophysiology and intelligence, immunity building, organ functioning, cardiovascular system, which is we see a lot of chronic conditions coming up, free radical scavenging properties, on which Amrit Kalash has the highest number of clinical trials, and gene regulation. So some of the areas in which, if you look at very serious trials coming in the indications. Starting with Amrit Kalash, I will not like to take much of the time, because last webinar, Dr. Rini has already taken on Amrit Kalash about its entire gamut of benefits and the various other things. But for the doctors, I like to say this: Amrit Kalash paste and tablet is one of the wonders that Mahasi Ayurveda has for everybody. Whether you are healthy, whether you are fit, whether you are suffering from any chronic conditions, Amrit Kalash is the wonderful rasayana that everybody should take. And the process that was started a long time back, the process still continues, and it's a very rigorous process, and 250 meticulous steps, 20 kg of raw materials, giving 1 kg of paste, and everything right from the body and the mind and the soul nourisher to rasayana for anti-aging, longevity and rejuvenation, stress, memory booster, body and mind relaxant. So not only it takes care of the part of the body, but also of the cognitive part, which is the mental aspect, right? And holistic health, if you look at entire oxidative damages, potent free radical scavenger. And in the clinical trials last session also, we have seen that it is 1,000 times more potent than vitamin C and vitamin E. And it raises an enzyme called as superoxide dismutase by 200%. So that this is an enzyme which body naturally secretes in order to adapt to the various stresses that
Yeah,
we
Anuj,
have. Yeah,
hello.
when you take Amrit Kalash, hello.
Yeah, there was some issues in terms of PPT. Some technical issues were there. So maybe you can just quickly start again with the PPT and briefly navigate through the presentation, and then
Now
maybe
it's
we can
visible?
take it forward.
Now it's
Yes, yes.
visible?
Now it's perfect, perfect, perfect. Thank you.
Okay, okay. So, welcome once again, and our guiding light, Mahasi Maheshwari with his blessings. I'd like to start the presentation. Mahasi ji always believed that if Ayurveda has to go on a global scale, we need to suddenly be, having data and various systems and processes and systems in place, so that we ensure that every medicine that is manufactured in Mahasi Ayurveda adheres to the global standards. And that is why, if you look at the last 30 odd years that we have been there in the Ayurveda segment, we have some of the very very credible certifications to our credit. We got incorporated in the year 1986, and one of the prestigious certifications, the ISO certification in 1999, WHO GMP compliance certification in 2007, and then if you look at the premium certification of Ayush Premium Mark in the year 2010. So we have a lot of prestigious certification over the years, and in 2018 we changed our brand identity to keep sync with the changing times, and this logo has been appreciated by many of the doctors. And if you look at Mahasi Ayurveda always believes that our products should withstand the efficacy and safety on various parameters, on the various benchmarks. And to do that, obviously, clinical trials is very, very important. And we have conducted clinical trials at some of the very, very prestigious research institute, be it in the US, Canada, Netherlands, Japan, and India. University of Kansas, Ohio State Center, University in Columbus, in US, Canada, University of Toronto, All India Institute of Medical Sciences, which happens to be one of the premier institutes in the country. They also, we have the clinical trials, SMS Medical College Jaipur, KGMC Lucknow, and in Japan, which is a very very regulated market, highly regulated market. There also we have conducted a clinical trial at the Gifu University in Japan. And these trials, they have come in some of the very serious disease indications like oncology, cancer. We have many trials on Amrit Kalash in that segment. Anti-aging, neurophysiology and intelligence, that is another segment in which we also have clinical trial. Immunity building, and this is the time, the COVID times, where people have a lot of focus. Everybody now actually understand what immunity is, right? And we have also done clinical trial on immunity building, organ functioning, cardiovascular system for that matter, a lot of chronic cases, incidents of cardiac problems, and we have also clinical trials in that. Free radical scavenging properties, in which, antioxidant properties and all, and gene regulation. So Mahasi Ayurveda as a company, if you look at, we have done clinical trials in some of the very serious disease indications, and this not few years back, but dating back as 1990s. So we started the journey of clinical trials way back when very few Ayurveda companies knew what a clinical trial actually looks like in the Ayurveda domain. Yeah, and this is our flagship product, which almost everybody knows, Mahasi Amrit Kalash, and Amrit Kalash, as we all know, is a super rasayana, a potent free radical scavenger, which is a natural one, and it takes care of the both body, the physical part, and the cognitive part, which is the mental part. Very well formulated, having lot many ingredients of a rasayana, adaptogenic, helps in the stress and the memory, body and the mind, and it comes in two variants, the paste and the tablet, and both are kind of synergistic in nature, which complements each other. If you look at the manufacturing process, it's a very very tedious manufacturing process, and I suddenly can tell you that we cut no corners in the manufacturing process. What has been established, what has been documented, till today we follow the same process, and 250 meticulous steps, 20 kg of raw material, giving us only 1 kg of paste. So you can understand how tedious the process will be of manufacturing Amrit Kalash. The Super Rasayan Amrit Kalash has far-reaching benefits, of ranging from holistic health, because it prevents oxidative damages, potent free radical scavenger, 1,000 times more potent than vitamin C and vitamin E. An enzyme called as superoxide dismutase (SOD). When somebody takes Amrit Kalash, the person takes Amrit Kalash, the level of SOD rises by 200%, which is a huge jump, and as a result of which, the person is able to cope up with the stress in the environment that the person is facing. So the person becomes adaptogenic. Yeah, cardiovascular system, LDL cholesterol, it kind of balances it. Arteries, it clears arteries and makes them healthy and all. Even on the treadmill test, which is a TMT test, and which is one of the markers for the doctors to test the heart health, it improves that. And the heart muscles, it kind of strengthens that. So Amrit Kalash, be it also on the nervous system, immunity, because there's a lot of talk on immunity as of now, if you look at. So all the T cells, the cells from the thymus, the macrophages, the lymphocytes, it improves the responsiveness of these by multiple times. Interleukin 2, which is also a very important marker for the immunity, that also increases the quantity, and because of which the person is able to fight, the various defense mechanisms are strengthened and able to fight and withstand the antigens that are there in the body. So I mean, Amrit Kalash, overall, if you look at 78 clinical trials have been conducted, or studies have been conducted, and if I can bracket them into preclinical 57, human studies 15, and 7 are the other studies. So overall, if you look at, Amrit Kalash works on a wide spectrum of diseases, and if I have to sum it up, right from the oral health to antioxidant and anti-aging, immunity, heart health, and then a very very important aspect of Amrit Kalash is the cancer prevention and chemotoxicity. We all know how cancer, one of the very dreaded diseases, and Amrit Kalash certainly has a lot of benefits in that. There are clinical trials going on of Amrit Kalash for cancer prevention and chemotoxicity also, as of now, and it is showing promising results. And that is one of the flagship brands that Mahasi Ayurveda has. Apart from this, I'll like to share with the doctors that about our glucomap, which is for diabetes. And this trial was conducted at AIMS. It was a double-blind, randomized, placebo-controlled trial, and the trial was done to evaluate the efficacy of glucomap on the type 2 diabetes patients. And it was, the control group was, for the glucomap versus placebo, and the aim was to observe this also the safety profile of glucomap. And this was published in the year 2005 in the Journal of Association of Physicians in India, and the results were very promising. HbA1c, which is the gold marker for the diabetes levels, was reduced by a level of P. If you look at 0.008, which is significant. Fasting blood glucose was also reduced, and the best part is that there were no adverse events that were observed. So if you look at the conventional therapies in the allopathy domains, be it the gliptins, be it the metformins, they suddenly have very very serious side effects, on a longer term. But with glucomap, certainly that is not the case, because everything is so well formulated, natural ingredients, and very well formulated. The other one we have Amlant, and I think Dr. Piyush and everybody knows very well that Amlant is a very very potent natural acid balancer. The formulation is such unique that it kind of takes care of the chronic acidity in a much much better way. And this trial was conducted also at AIMS Delhi, and many of the doctors have asked me that how Amlant can be compared with, at that point of time, the gold standard was ranitidine, right? And we compared Amlant with ranitidine on the in the non-ulcer dyspepsia patients. And the safety profile, if you look at, also results were very very promising. 48% in the patient group, 48% responded to Amlant, whereas in ranitidine group it was only 27.5%. In the ITTT, which is intention to treat analysis, that means how many patients have join the group, and some patients leave out because of certain reasons, some is not able to complete because of their personal issues and all. So intention to treat analysis on that parameter also, if you look at, 34% responded well to Amlant, and only 22% in the ranitidine groups. So in conclusion, short conclusion is that Amlant is as effective as ranitidine for non-ulcer dyspepsia patients, minus the side effect of ranitidine. And Dr. Piyush and others, if you would have seen very recently, there was a lot of coverage on ranitidine as to how it has an NAMD, which leads to cancer and has carcinogenic properties. So Amlant, I can very well say, all natural Ayurvedic preparation formulated in a synergistic way without any side effects. Very safe, very effective, especially in the chronic acidity cases. The other preparation that we have from Ayurveda, from Mahasi Ayurveda, is Levomap, which is another wonderful product. And this trial was also conducted at AIMS. It was a double-blind placebo clinical trial. And in this, we kind of looked at the comparison of Levomap on the non-alcoholic fatty liver disease, NFLD, because that is one of the upcoming indications, and close to 15 to 20% patients actually suffer from NFLD. And also the secondary endpoint was to compare the safety profile of Levomap. So if you look at, total 58 patients were there in the group, and 8 patients were not able to complete the study. But if you look at the two groups, the placebo group and the Levomap group, 26 and 24 were the patients respectively. The mean age range that we chose was 43 and 42 years, which was kind of in which the NFLD patients typically are seen. And if you look at the results, which were very very encouraging for Levomap, the triglyceride levels, they were reduced and significantly to 0.02. The pain in the abdomen, which is one of the another key marker for NFLD patients, that was also reduced. The hepatic steatosis, which is another parameter for the NFLD patients, that also kind of reduced in the ultrasonography, which was very encouraging for us. The plasma transaminase levels, there was no effect in the both of the groups, and certainly there were no side effects. So Levomap is another wonderful product that I must recommend to all the doctors. You can use it. Other product, if I can, for the chronic problems, Cardimap is a wonderful product for hypertension, and especially mild to moderate cases. Contains Sarvgandha and Jatamansi, Rauwolfia serpentina, and a very very effective medicine for the patients who have hypertension, and also anxiety and stress and insomnia, which is a result of the high blood pressure or the hypertension. Apart from that, we have Lipomap also for the lipid patients who have the problem of lipid imbalance, hypercholesterolemia, hyperlipidemia, and the various coronary artery diseases. Very effective, very safe, and can be taken by any age of the patients. Generally, in this times, Dr. Piyush, if you look at, there have been a spike in the levels of the asthma problems because of the seasonality of the rise in the pollen content and the pollution and all, right? So Asthomap is another wonderful product. The key aspect of Asthomap is that it is prepared by original Vanshlochen, and we have seen over the time that how Vanshlochen, or the real and authentic Vanshlochen, is very very important, because that is one of the wonderful product for taking care of the respiratory issues, right? So Asthomap is a wonderful product. And we recently also launched Prostomap in the COVID times, and this is one of the product which has been available in the EU markets, European markets, and the US markets for a long period of time, close to at 10 to 15 years. And it has established its efficacy and safety. In India also, many of the doctors have used this. Very very encouraging results in the management of various prostate issues like the benign prostatic hyperplasia and the urinary problems and all. Apart from this, to kind of take care of the COVID related symptoms. If you look at the infections and the seasonal flu, so we launched Ayu Defense AV, which is a very, very effective synergistic combination of herbs formulated by the expert Vaidyas at Maharshi Ayurveda. And it is a very, very effective one. I have also taken when there's a lot of symptoms and all, and it works wonderfully well. Apart from this, we have Prandhara, which is for the common ailments like cough and cold and all, nasal congestion and all. Raktadai is another wonderful product for the anemia. A lot of fine particle bhasmas, Saputti Kantla bhasma. We have also calcium in this, because usually if you look at in the allopathy space, iron and calcium is not given together. But in Ragdada, it's a wonderful combination of iron and calcium, which at in one tablet the patient gets all the benefits that are required. Apart from that, it also boosts the immunity of a patient. So a lot of benefits of Raktada, and kind of it restores the blood biochemistry, which is kind of imbalance is there if there. Reston is another product which is for the women uterine health problems, because of the various hormonal changes, because of various issues and all. I like to stress upon Dr. Piyush on Reston, because there have been a lot of cases, if you see, of polycystic ovarian syndrome, PCOS or PCOD, right? And these patients, they are very susceptible to be kind of developing into a full-blown diabetes at a later point of time. So Reston with glucomap is one of the wonderful product that you can club and give it to your female patients who are prone to becoming develop diabetes at a later stage. Apart from this, Kasni, another very, very good product for cough and sore throat and other issues and all, expectorant, bronchodilator, and it is also effective in the allergic cough, which is in the current season, especially in the NCR and the Delhi region. If you look at a lot of cases of allergic cough and all. So this is a small preparation, small snapshot of the profile that we have, Dr. Piyush, uh, for today's uh, for today's presentation. And I think many of the doctors would have already been using some of our products. There's lot many products, Dr. Piyush, be it classical and proprietary, but due to the paucity of time, I do understand it's very difficult to showcase the entire range of Maharshi Ayurveda products. But I can assure you very well, you would have also used. Many of the doctors would have also used, the efficacy and the safety is unparalleled, and we certainly take a lot of pride in our products, in the way it has been formulated, and the way the patients have been benefited. So, what do you, Dr.
Absolutely. Absolutely. I think, first of all, thank you so much for this wonderful presentation, Anuj. And I was also not aware about couple of products which I got information today. Although we are using most of your products, first of all, I would like to emphasize one aspect, that to all the people who are listening to us today, that these products, all the products Maharishi Ayurveda have, are having excellent quality. There is no doubt, I think, and no issue in terms of the quality of your products. And we have seen, and by the way, there is second aspect to the entire thing is, what happens is these days many patients are not looking for so many medicines or so many products as far as a particular indication is concerned. For example, if they are looking for a solution in hyperacidity, so they just need to they have a habit of popping up a pill and it is fine the whole day. So the same they want to replace with Ayurveda. Now in Ayurveda, the challenge is, although with due respect to all the companies, there are excellent classical preparations, but sometimes we have to use multiple, and there are permutation and combination, or sometimes they are in the powder form or bhasma form or that kind of stuff. But the same, if there is a single tablet, like I'm just sharing my example, my experience with Amlant. So they are just popping up, and they are getting the same, in fact better results many times. And many patients are right now replaced their allopathic and other system of medicines with Amlant. And as you have discussed about this Rantidin study, in fact, with full confidence, what happens is, many times whenever somebody is coming for the first time in Ayurveda, they are having some queries and issues that whether Ayurveda will work or not. So I clearly say them, boss, do one thing, just Google it. You will find this medicine has been examined or has been tried with the contemporary which you are already taken in a reputed institute like AIMS. I think this was done in AIMS, right? So
Yes.
so in that way, the patient also get the confidence that whatever the pill and whatever the Ayurveda medicine I am using has been exhaustively researched. Like for example, Amrit Kalash. So many people are saying. In fact, I will come up to that question in this as well. So many people are saying about the costing. Oh, it is having maybe 2 times or 3 times expensive what we used to take as far as a normal Chavanprash is concerned. So first of all, I said, boss, this is not Chavanprash. There is something different. And second, you can Google this and you can maybe search this. And right now, I can say with more confidence because I have also started taking Amrit Kalash in terms of the efficacy, in terms of the productivity, in terms of the overall alertness in terms of physical, mental. I can feel the difference. To be very honest, till now I have not used, but when I learned and when we did a couple of sessions of Amrit Kalash, and when I saw this exhaustive research and this exhaustive homework you people have done, and it is one of the most researched rasayanas across the world. So I just thought to maybe have it like I frankly speaking, I just started to giving it a try. But when I started this, I realized that within few days it is making an impact, and now without fail I take the paste as well as the tablets, and I'm very much in for this product now. I have in fact recommended to many more in my family and friends as well. So on that note, I would like to ask you. I know the answer because I'm using the products and I can feel the difference. But as far as and first of all, thank you so much, all the doctors. We are just getting so much of queries and questions are pouring in our social media. I have I think 5 to 6 questions in my messenger box also, which is linked with the website. There is a very huge significant number who are watching us on right now on website as well, and I just checked in Facebook. We have touched around 1,000. It has been reached till now. It has been seeded to around 100 groups right now in Facebook as well. And sorry for a small technical error. Actually, there is a heavy rain right now in this area, and due to that there was some connectivity issue. We have backups and all, but I think for a few minutes it has gone. So let's start the questions now. Shoot whatever you want to ask. Anuj is with us today, and we will definitely ask him as maximum possible questions today. He's a busy man, so today he has got some time. First question to you, Anuj, is as we all know, I will not say my point is, see, in my mind, it's not expensive. I want the quality. I will pay. I want to drive a luxury car, so I will pay for that. And I know the benefit of driving a luxury or a safety car rather than a small budget car. And same applies to other gadgets or many things as well. For example, if like I'm using this, like we are doing all this on this MacBook, so I know the quality. That's why I'm paying that. So that is there, but still some people the answer one answer can be don't match apple to apple. Still many people, many doctors have this apprehension about the cost. Sometimes they feel that Maharshi Ayurveda products are a bit costly and all. But what is your take on that, and what is your answer to this particular issue?
So I think Dr. Piyush, you have raised a very pertinent point. You know that uh, there's this constant thought in some of the doctors' mind that maybe the price of the Mahashavada products is slightly costlier. Let me connect the dots with the last webinar that you had with Dr. Rini, right? And Health Economic Outcome Research (HUR), and one of my papers that I've published in Market Access. Let me correlate this with the entire landscape so that it's very easy for the students and the doctors to understand also. Usually, if you look at Dr. Piyush, the Ayurveda doctor is not the first touch point for any patients, or for the majority of the patients. Yeah. So if I have a diabetes, if I have asthma, the first touch point obviously is an allopathic doctor, right? So let's take an example of a diabetic patient. Yeah. So he visits a doctor, allopathic doctor. He is on metformin, gliptins, and others, and all for a longer period of time. So what happens eventually, over a period of time, the dose has to be increased, and because of the increase in the dosage, right, there's a lot of side effects, right? And after some 5 years, 7 years, the patient starts to look out for Ayurveda or for alternative therapies, and that is the time when a patient actually is, reaches out to an Ayurveda doctor. So if you look at, many of the doctors have told me this, that for such chronic conditions and others, usually they get patient at the fag end of their career, at the fag end of their disease profile. So diabetes which has not been managed properly for say like 7-8 years, the patient lands up in an Ayurveda doctor's chamber, and he kind of tries out the Ayurveda because of allopathy is not able to provide him a cure or a sustained relief, right? And at that point of time, Dr. Piyush, if you imagine, if the quality of the medicine and if the potency, in the pharmaceutical terms, if I can call it, if the potency of the drug is not good, obviously the patient will not get relief. So what happens is, although the patient is using an Ayurveda product, yeah, he will continue to use it for 2 months, 3 months, 6 months, but after that, what he will say is that mera paisa to chala gaya, yeah, my money is gone, yeah, but I have not got the desired result. So it is not only the doctor that bears the brunt, doctor ka naam bhi kharab hota hai, but साथ में the entire Ayurveda category bears the brunt. या तो नाम तो सिर्फ डॉक्टर का नहीं खराब हुआ, पर आयुर्वेदा ऐसा फर्टेनिटी का खराब हुआ. फिर द पेशेंट सेज, अरे यार ये तो आयुर्वेदा वाले कुछ भी बोलते हैं, right? Just to give you another perspective on this, one of my friends, he got he tested positive, for borderline diabetes, right? And he reached out to me and said, can Ayurveda help me in this, right? And I referred to the friend to the Shalimar Bagh hospital, right? He was little apprehensive whether Ayurveda can help him managing the borderline diabetes in a much better way. But since 6 months have passed, and he continues to be, taking Ayurveda medications, and he is perfectly well, and he has propagated this to his many peers, friends, families, and all. So because of which, not only Maharshi Ayurveda, but Ayurveda category in general, if you look at the trust, the kind of faith in the medicine goes up by leaps and bounds, right? तो उसमें जो विश्वास बढ़ता है, that is not only good for Mahasi Ayurveda but Ayurveda category as journal. Because अगर हम देखते हैं तो one of the common complaints that any journal public or any person have is that, अरे आप तो Ayurveda वाले कुछ भी बोलते हैं, कुछ भी claim करते हैं, है ना, ये भी हो जाता है, वो भी हो जाता है. But as they say, the proof of the pudding lies in eating, right? So when the person gets benefited, obviously, right, I will definitely be much beneficial. So if you look at the cost wise, there might be slight, I don't say that, it is not costly, but yes, if you look at the value that you give to the patient, right, and the kind of trust that the patient gets, oh, I've used Amrit Kalash, as you are saying that, right, I've tasted Amrit Kalash, I've used it, I'm feeling better. I've used Cartimap, and Cartimap kind of gives me a very good control on the hypertension levels. I've used Glucomap. Glucomap helps to, keep my blood glucose levels in check, HbA1c in check. So definitely, I will be a very satisfied and trusted customer, right? And then I will kind of be gaga about it, and about the entire therapy area. So cost-wise, if you look at, we might, some preparations might cut some corners, 5-10 rupees here and there, but if you look at in the long term, and that is what health economic outcome research is all about, that in the certain money that a person has spent, what is the value, what is the benefit that the person is getting. So for this short period of time, the cost might be higher, but on the longer perspective, you look at, the kind of hospitalization, the kind of other complications, increasing, that is also taken care of. Yeah. So I mean, to doctors, to all the Ayurveda students who are watching us live, let me assure you that we certainly cut no corners in our quality of the products, because that is what we are there for in the market, and that is what one of the key highlights of Mahasi Ayurveda has been there in the minds of doctors. So I've met many of the doctors in these 3.5 years. So हर कोई डॉक्टर ये बोलता है कि आप अपनी दवाई के बारे में मत बताइए, हमें सब पता है, quality is very nice, right? But you are little pricier, right? So this is one of the reasons, that we should look at the potency and the purity of a herb, which is very important, right? Yeah, Dr. Piyush?
Yes, Anuj, definitely, and I completely agree with you on that. There are some questions, in fact, about your product catalog. So maybe after the session, what I recommend is you can share the link if it is available on your website, or
Sure.
you can share a PDF. We will upload on our social media. And I request Dr. RP Singh also to, maybe if he can share his email ID or contact number, so that we can connect you to the Maharishi team and they can mail you the product catalog as well. Dr. Danish, the session is not on Zoom, It is on Facebook, YouTube. I think you are watching us on Facebook. In fact, Dr. Danish inquired a very valid query. Maybe it is a challenge of compliance that Amrit Kalash comes with a paste and a tablet. So he's saying that why not to have separate tablet as well, because sometimes patients are facing problem in terms of they finishes the tablet but paste is still there and they are using it. Maybe sometimes we have seen that they are not taking twice, they are taking once as well. So these kind of compliance aspects are there. So ultimately end of the day what happens is again they have to purchase the complete kit if it is there in a separate tablet form. So maybe paste is there for few days and they can continue with their tablets. So is there any separate packing available or not right now?
Yes, yes, Dr. Piyush. In fact, Dr. Danish, thank you so much for your question. Dr. Danish, we also have Mahasaya with Amrit Kalash, a dual pack DP. And apart from this, there are separate SKUs also available. So let me please share your contact details, and I will definitely reach out to you and ensure that the separate tablet as well as the paste, because we also have a separate tablet and a paste. We also, because we understand that sometimes the patient might need a separate tablet or a paste, so that is also available. Yeah.
Right. And Dr. Hamid also is asking for catalog. He has shared his number and all. We will
Sure.
connect Dr. Hamid to you, and he wants to tie up with you. And there is a medical hall near his place in Hyderabad. So we'll definitely connect you. And thank you so much, Dr. Santosh, for sharing email ID. One more aspect, I think you have already mentioned about joint pain product, and maybe Dr. Danish has joined late. Still, if you can.
Pirant, so
Uh,
Dr. I'm very excited when he says joint pain. We have Pirant. Pirant is an amazing product that we have, and for chronic joint pain patients, be it rheumatoid arthritis or osteoarthritis, it works wonderfully well. It comes in a tablet and an oil form, and both are very, very important because both are synergistic in nature. Yeah. So, Dr. Danish, thank you so much. I will definitely reach out to you and ensure that the Pirant oil and tablet is kind of supplied to you. Yeah.
Yeah, in fact, Dr. Danish has mentioned, and he's at AIMS Bhopal Ayush department. So I think maybe you can connect your local team to him. You must be having somebody from like Bhopal or nearby area. So maybe he can visit Dr. Danish, and I think he's at a very prestigious institute. So it will definitely help him and others also to propagate Ayurveda at that particular region. Uh,
Sure.
acco- uh, Adding to that, one more aspect, Anuj, we want to ask. We know that everything is digital. Our platform is also digital. What do you think now? Again, the I think people are going again. Your person is coming to our clinic and other doctors also. So, what do you think? The conventional model will again back in picture. Digital will not be there, or it will be in parallel. Maybe we can also have some inputs from you about your experience and how Maharshi Ayurveda and your company is also thinking on the same note, that how 2021 will continue. Although, as per our inputs and our some data and some research, it will definitely now a compulsory and a mandatory aspect of all the organizations to at least have some presence on digital, along with whatever the conventional models were there previously. So, what do you think now? How to take it forward as far as 2021 is concerned?
That's a very pertinent question, Dr. Piyush, and who has asked this? My thanks to him for asking such a good question. Because in COVID times, we looked at there was a lot of thirst on reaching out to the doctors, and obviously, digital is a platform, digital is a channel, through which you reach out to a lot of doctors and a lot of patients, in fact, right, and the customer, right. So, without an iota of doubt, yes, digital will continue to increase, yeah, the momentum, the penetration, because nothing can beat the reach and the penetration of digital in terms of the reaching out to the people, right. But if you look at the entire landscape, Dr. Piyush, right, as the clinics have opened, as the doctors have come back, and my answer is pertinently only to the doctor segment, the conventional model of a medical rep visiting a doctor, right. So if you look at these times, now again the entire landscape or entire channel is back, right? And obviously, if you look at doctors, many of the doctors, even if you try to reach on phone or on digital, but they certainly will like to have some person visiting them face to face, right? And then kind of talking about the products and things like that, right? So from a doctor standpoint, from the patient centricity, if you look at, this is an important kind of aspect that has come up. But even for the companies, if you look at many of the companies, if you look at the total percentage of sales of the digital vis-a-vis the conventional model, right? It's not that big. I have the data of certain companies, right? It's 4 to 5% of the total pharma sales vis-a-vis the digital sales, right? Why? Because the reach is very easy. Yeah, you can reach 1 lakh 1 crore people at one point of time. But what is essential, and that's where the insights of the pharma channel comes into picture, right? Is that a doctor will definitely like to have a face to face interaction, although not as on a regular basis, which was pre covid. Yeah, but certainly somebody to kind of so that gives a reassurance to a doctor that that's kind of very convincing to a doctor. So certainly the digital will evolve in the times to come. But I certainly also see a evolved pharmaceutical or the medical rep model coming into the picture, and that will continue to drive the momentum for the doctors and the pharma channel and the medical rep channel. Yeah.
Great, great. And there are a couple of more questions. And prior to that, I would like to ask one aspect which I thought when I was just going through your profile. What exactly is sensory branding in Ayurveda, and what exactly you are doing research? I think this is your research topic as well. So maybe
Yes.
you can just share some piece of information on that as well, because I personally want to understand more on this.
Yeah. So this is a very very unique topic that I've chosen for my PhD, and I've not been able to devote much time towards my PhD because there's a lot of work here. But sensory, if you look at sensory, means all the five senses, very layman terms: eyes, sight, touch, feel, and all, right? So in the marketing field, if you look at the sensory has evolved over a period of time. Yeah. Just to give you a quick sense check, uh, any product, if it is there in the market, right, is the eyes that we see, and the touch, and the ear, the sound that we hear, that is all what is called as a brand memory that forms in the mind, right? And there's a famous person called as Martin Lindstrom. Yeah, Martin Lindstrom happens to be the sensory guru, so he piloted this whole idea of sensory branding. And if you get time, you certainly should read about him. Amazing person who has done a lot of work. So he piloted this sensory branding concept. And sensory branding, what it does, it kind of makes a person loyal to a brand, so that all the sensory aspects are kind of integrated in the memory of a person. So Martin Lindstrom once was walking in a mall in Europe or somewhere, and he had that perfume smell of somebody, and that kind of reminded him of his childhood memories with somebody else. So a small example of perfume kind of correlates to somebody else, right? So sensory marketing and branding, what it does is it want to encapsulate all these sensory touch points that a customer will have, so that he becomes a loyal customer to the brand. And just to draw a very beautiful example, Singapore Airlines, that was one of the first airlines that kind of championed this concept. So if you board a Singapore Airlines anywhere in the world, as soon as you enter the chamber, yeah, you'll have the same sight, you'll have the same smell, you'll have everything same. Yeah. So even as basic as Kellogg's cornflakes. Yeah, so many people might not know Kellogg's cornflakes, because Kellogg's, after all, it is what you call makke ka dana, right? Kellogg's. Yeah. So Kellogg's, they work with a consulting firm from, I think, Denmark. Yeah, which advises them on the sensory aspect of a Kellogg, the sound of crunchiness that you get, right? So when a person takes Kellogg, that is the crunchiness that he gets, right? So I mean, sensory is something. If you look at some of the acidity brands, right? So what they do, when they pour in a glass, there's a lot of what do you call the gas, the ferment, the foams and all coming in, right? So it kinds of appeal to the senses. And Ayurveda, by and large, if you look at Dr. Piyush, from a marketing standpoint, that is one area where there's a lot of work that needs to be done. In the conventional other areas, if you look at, be it the automobile industry, be it the aviation, be it the consumer, be it the other industries, it's all boils down to sensory. If it is not appealing, if it is not visually appealing and kind of attractive, definitely a customer will not like to pick up. So if you look at your what do you call conventional proprietary, if not proprietary, your medicines, kashayas and all, their packaging, their the way it has been done, it doesn't make a lot of it does not appeal to the senses of the normal consumer, right? So this is one of the topic that I'm working on, and it's a very interesting topic, and I hope to contribute something to the Ayurveda field in terms of the sensory branding. Yeah.
Great, great. I think that is a wonderful concept, and we definitely are looking forward to have many more insights. And in fact, I have seen many doctors are appreciating right now, because we have seen many doctors are having their multiple clinics or multiple centers, so they also can follow this particular methodology and particular fundamental of having the same SOPs and the same. It's like when you like have this McDonald burger, so the same thing will be there in the entire world, so it's kind of
Yeah.
that. So definitely I think it is one of the very significant fundamental, and all the Ayurveda domain stakeholders should definitely take it serious, and let's have some more insights in maybe the future sessions from you
And
now. Yeah.
Dr. Piyush, just to add on, you brought a very important topic of hospital clinics, right? Yeah, which is from a sensory standpoint, if you look at. So all these corporate hospitals, be it the Apollos, Medantas, or these hospitals, the idea actually came from the sensory marketing, sensory branding, right? So usually, if a person is admitted in a hospital, usually the chances of getting him a nosocomial infection, which is an hospital-acquired infection, is much higher, right? So somebody thought that why not have a hospital which looks like a hotel, right, but also provides hospital services, right? So that is how the model of fusion of hospital as a services and hospitality as also a service kind of fused, and you have these corporate hospitals, right? So there's a lot of sensory elements. If you look at, you go to any of these hospitals, you will not have these conventional, वो जो बोलते हैं ना, सरकारी अस्पताल में आप जाओ तो there's a lot of smell and of phenyl, and also you are already sick. Yeah. So I mean, there's a lot of sensory elements that even in Ayurveda clinics that we can certainly look to incorporate and make it much better. Yeah.
Right, right. And thank you, Dr. Danish, also that he is working on cancer patients and getting very good results. Many doctors are asking, let me answer this. Yes, Maharishi is having the provision of providing you complimentary samples. So, what we'll do is we will connect you to the sales team. They will be in touch with you in your area, and you can take it forward in terms of dealing with them. And I request again, many doctors have shared their email IDs and mobile numbers. So whosoever have joined late and right now listening to us, you can share your email ID and contact number. We will definitely ask the concerned person in Maharishi Ayurveda to connect with you and to take it forward. On the same note, there are some announcements, some future plans of 2021. Maybe today we will not be able to reveal that, but very soon you will be getting. Most probably in the next session with Maharishi Ayurveda, we will be posting the update maybe by maximum by tomorrow or day after tomorrow to all of you. There is a very big announcement coming up. On the same note, I also want to ask this particular question to you, Anuj. Being a global leader in terms of Ayurveda, we know that you people are so in so many countries and all. Maybe you have seen some learnings in this particular challenging time as well. Now, how to take it forward in terms of your, maybe we can say, message, or your and your company insight for specifically for Ayurveda doctors, practitioners, and to the students as well. Here, what we believe in Indian Vedas is you people are manufacturing the medicines, you people are developing the products, and ultimately, end of the day, the doctors and students who are the budding doctors, who are the doctors in making, will be prescribing that to the patients. So let's connect both of them directly, and let's pass on the maximum benefits ultimately to the patients in the entire process. So what exactly is your now message in 2021? It's a new year, so what you and your company is thinking as far as the Ayurveda doctors and students are concerned, and how they will be benefited more and more while doing business with Maharishi Ayurveda.
Yes. So, Dr. Piyush, let me again reiterate what I said earlier. That Mahasi Ayurveda believes in serving the doctors to the best with the best possible medicine in terms of the quality, efficacy, and various services. So, we are also a prominent player in the services segment. We have Mahasi Ayurveda Hospital in Shalimar Bagh and various wellness clinics in different parts of the NCR. So one of the message that I from the Mahasi Ayurveda company would like to give to all the Vedyas and the doctors that were watching us and who have been a kind of a critical kind of doctors in our journey is that we are very serious in kind of providing you the solutions for the benefit of the patients, right? And for any doctor, if you ask, the ultimate aim of any doctor is to alleviate or to reduce the symptoms or the suffering of any patient, right? So that is the ultimate mantra that a doctor believes in, right? So that the patient feels better, and the trust of the doctor also increases. So Mahasi Ayurveda as a company, we certainly are poised for new offerings, yeah, in terms of the products and in terms of enhancing our standards to meet the expectations of the doctors. And we are also piloting a model in which we look to cater to doctors who are very selective about the quality of the medicines in a very commercial way. And we are working on a model so that we can reach out to the doctors and ensure the accessibility and affordability of the Mahasi Ayurveda products. So having said that, let me also reiterate another point, that we certainly want to be seen as a company which cut no corners in manufacturing of the products. So we never and we will not compromise on the quality of the products. And we also want to give this message out to the doctors that if you believe that quality of a product is of paramount importance, and a symbiotic relationship is that we are looking at to forge with the various doctors in India and different parts of the states of the country. And very soon we will like to be engaging with many of the doctors in terms of the clinical trials, in terms of the observational trials that we want to conduct, and in terms of the various other initiatives that Mahasi Ayurveda will do. Over the last 3.5 years, if you look at Dr. Piyush, we have done many CMEs at different parts of the country, and that was kind of a catalyst for doctors, and they certainly are now much more aware and much more confident of using a Mahasi Ayurveda product. Webinar was also another initiative that we did in the pandemic. There were a lot of also what do you call patient-centric campaigns and all, the diabetes campaign, the asthma campaigns, and others, which we have piloted and run with various doctors in different parts of the country. And I must say that the response has been very, very encouraging, and I certainly look forward to a very fruitful and a very encouraging year with the doctors of the Ayurveda fraternity in India. And if there are any concerns, any issues, we will certainly like to address them, because we believe that the learning that the Ayurveda fraternity had, the knowledge that Ayurveda doctors have, certainly needs to be kind of encapsulated, kind of synthesized to kind of come out with very effective, tailored, customized solutions for the benefit of the patients. So yes, we at Mahasi Ayurveda, we are very much focused on the R&D aspects. There are a lot of research going on in the AIMS. We have also some of the trials that are also going in the US, right? So in terms of the solution for the patients, Mahasi Ayurveda is there for the betterment of the patients in terms of the quality products and the solutions. So that is an assurance that I'll like to give to all the Ayurveda doctors that are kind of watching us. Yeah, Dr. Piyush.
Great. Thank you so much, Anuj. And I think we are using several products from Maharishi Ayurveda in our clinic, and from other fellow doctors who are practicing and prescribing Maharishi Ayurveda products. So definitely the quality is excellent, and we are looking forward to have. Hello.
Yes, you're audible, Dr. Piyush.
Yeah, so we are looking forward to have many more like maybe new launches and new products from your company. And thank you so much for giving time. I think with couple of technical glitches, we were able to manage the today's session. The weather is really bad here, but still, and I can see so many doctors roping in and sharing their details. So we'll definitely share all your details with Maharishi Ayurveda, and Anuj with his team will definitely be reaching to all of you as soon as possible. And there is a very important announcement and very important update coming up maybe in this week. Keep on checking our social media handles. We will definitely posting as soon as it will be finalized. And we request all of you to join the next session of Maharishi Ayurveda. That will be a very important session for all the doctors, for all the practitioners, and something new is coming up in this new year. On the occasion of New Year, a very happy New Year to all of you, and thank you, Anuj, for joining us today. It was a really wonderful session. I must say, and I must admit this. That there are very few professionals, and after listening you from last 1 hour, we can re-emphasize that point that definitely you are having a deadly combo of pharma experience as well as now you are in Ayurveda. So we wish your journey will continue as long as possible in this domain, so that all of us will be getting benefited directly or indirectly from your experience. And wish you all the best in your professional life. And we are looking forward to have many more successful journeys with you and your company, that is Maharishi Ayurveda, for all the fellow practitioners and for the patients as well. Thank you.
Thank you. Many thanks, Dr. Piyush.
Thanks to all the doctors and people who have joined us today. Keep on supporting us. Thanks.